Actually, all women are at risk for developing breast cancer. About 1 in 8 women in the United States will develop breast cancer at some point in her lifetime. That means that each one of us is walking around with about a 12% risk of getting breast cancer. But for some women, that risk may be higher, and for others, that risk may be a little bit lower. So what are some of these risk factors that we talk about? One important risk factor is whether or not anyone else in your family has had breast cancer. Family history on both your mother's side and your father's side is very important. So talk to each other. Find out if anyone in the family had breast cancer, and if so, how old they were when they were diagnosed. It's important to know how close those relatives are. So if you've had one very close family member, a first-degree relative, and by that we mean a sister, a mother, or a daughter, first-degree relative, who's had breast cancer, that may double your risk of developing breast cancer. The more numbers of individuals in a family, and the more generations that are involved with breast cancer, and the younger the age of diagnosis in the family, the higher the risk is that there may be a significant genetic susceptibility to the development of breast cancer. So if you have a lot of breast cancer in your family, and even other types of cancers, most importantly ovarian cancer, then be sure to discuss that with your doctor, because you may be someone for whom we should think about looking for abnormalities in the genes. In other words, looking for genetic mutations that may increase your risk of breast cancer. But with that said, only about 10 or 15% of breast cancers are related to genetic abnormalities.